While we're on the topic of the like problems with research and inflammatory headlines, there we don't have to spend much time on it, but there was one the other day. I mean, I don't know when it started, but there's some study or series of studies about erythritol, where people, which is a sweetener that's really common in keto products, if you will, low carb products.
Yes.
And in fact, whole companies have basically been invented around or created around like, erythritol based ice cream or whatever. And so
Yes.
then there's these headlines about erythritol causing heart attacks and other adverse cardiac events, which I looked at a little bit the other day, and it's kind of laughable when you actually look at all the details. But do you have any brief thoughts about that?
Just that I'm in the same camp you are on that. If there's an issue, it's a minor issue, and it's the least of our concerns. These people write these things, and they have no problem apparently with all kinds of other much more dangerous things people consume. I don't recommend consuming a lot of artificial sweeteners. I avoid them for the most part, just because it keeps me wanting things sweet, right? So if you don't eat things that are blatantly sweet, you're very tuned up. Things that used to not taste sweet taste sweeter. I really don't want to. I'm not a fan of finding quote keto products that allow me to pretend I'm eating a ketogenic diet, but still having my loaf of bread or this or that. In general, they're okay, but I view them as frankenfoods. But the reason I don't eat them is because it stimulates me to return to wanting these things, right? So if you start eating ketogenic sandwiches because the bread is somehow low carb, then, for me at least, it would make me interested again in having bread. And I've lost my interest in bread. I don't want to regain it.
Yeah, for sure. Yeah, so sweeteners in general, may be better to avoid for the reasons you stated. Just for I'll see if I can do a really simple recap of what the erythritol thing was about, just for the listener who may not know. So the first step of it was basically they were just looking for anything in the blood, like people kind of observing like people that end up having these heart attacks and things. What are some things that are elevated in their blood that we can kind of pinpoint? And one of them was erythritol. And I actually didn't remember this from biochemistry back in the day or whatever, but when I was looking at a little bit of analysis of that, I realized, erythritol can be elevated in the blood just endogenously. Your body makes it. I guess it's through the pentose phosphate pathway. So in other words, when they looked at, these people that have heart attacks have high erythritol levels, they didn't even ask the question, are they consuming erythritol or is it coming from their body? All they noticed is that it was high in their bloodstream. So that was kind of step one of what they did. And then the third part was actually in a petri dish, basically like putting the erythritol in the blood and saying, it makes it clot more. And so maybe it's plausible or whatever. And the middle part was like giving erythritol to people and seeing, does it raise their blood levels of erythritol? Yeah, it does. Okay. So then they stitched those three things together and said it might, increase your risk of heart attacks. And so of course the headlines are, out of control, I'm sure.
Right. Yeah. And when you think about how that study was conducted, it clearly had the goal of showing that erythritol was problematic.
Yeah.
These kind of studies, it's very hard. I heard somebody the other day complaining about the United States, was terrible because we did worse than some undeveloped country in the response to COVID in terms of the fatality rate. Well, all of their theories were nonsense. If you just look at the age distribution, the primary problem is in the elderly. And the United States population is much more elderly than the countries they were comparing it to. Also much more obese. But neither was what they wanted to talk about. They wanted to talk about something else. The two elephants in the room were just ignored, right? Just don't look over there. Right. I mean, Italy got clobbered. They have maybe the oldest population in Europe. age is the primary driver of all disease. It's the risk factor for everything. I can't think of a disease. Well, there's a few, but they're obscure. For most chronic disease, age is the primary risk factor.
Yeah. Yeah. So lots of problems with the way that research is done and the way that research is reported.